The nurse can identify a number of ethical problems in this scenario. The doctor in this situation has unethically denied Joseph's rights by not being open with him about his condition, and also by disclosing his health information to his family without his permission. In this scenario, there is no suggestion that the family are authorized to receive medical information about Mr. Kingi, which is a breach of the patient's privacy. Also, the patient has the right to know his diagnosis, and he should be the first person to be told, and the patient himself should be able to choose who he wants to pass this information on to. The day staff know that Joseph's diagnosis has been withheld from him, and none of them have stepped in to advocate for the patient's rights. Based on our interaction with Mr. Kingi, it is clear that he is aware that information is being kept from him, and this is causing him distress, which therefore means his mental and emotional well-being is not being adequately cared for. Mr. Kingi came into hospital with complaints of intestinal cramping and the presence of streaks of blood in his feces. Following tests and analysis of these symptoms, he has been diagnosed with inoperable bowel cancer. The patient has said none of the day staff will tell me what's going on. He is visibly upset by the lack of information he is being given, and has made it clear that he is aware that his condition is serious and is upset that people aren't being honest with him about his own health. This suggests that he values honesty and believes that he has the right to be informed and make decisions regarding his own health. However, this seems to conflict with his family's values. The family and doctor stated that they will choose to tell the patient when everyone is ready. From this, we would assume that the family values everyone being prepared for the diagnosis and for dealing with the consequences of Joseph receiving their bad news. In this case, it is clear that the family believe that they have the right to choose when and how Joseph will be informed of his diagnosis. Joseph is Māori, so culture may be playing into this belief. For many Māori people, the concept of whānau is important, and often family are involved in care decision-making regarding their loved ones. However, usually the patient is not excluded from this. Looking at the laws and policies relevant to this scenario, New Zealand healthcare providers are obligated to uphold patients' rights as per the Code of Rights and the Privacy Act. In Joseph's case, many of these rights have been breached. For example, all healthcare consumers have the right to be told things in a way that they understand and the right to be told everything you need to know about your care. But in this situation, the patient hasn't been told of his diagnosis or care at all, let alone had a chance to ask questions to gain an understanding about his condition. All service users also have the right to support and the right to make choices about your care and support, but because he has not been given any information about his care, he is unable to do this. Although his condition is inoperable, there are more care and supports that Joseph may need. For example, he may require mental health support in order to come to terms with his diagnosis, or he may require social work and needs assessment and service coordination to make arrangement for at-home support and/or end-of-stage life care. In addition to this, in Joseph's situation, his personal information was disclosed in a way that breached his privacy, and there is no evidence to suggest that he authorized personal information to be disclosed to his family members, and there are no reasonable grounds stated in the Privacy Act to permit the disclosure of his personal information without his permission. Another ethical framework the nurse should consider is consequentialism. This theory determines whether something is right or wrong based on the consequences of those actions. Therefore, based on this theory, if the end outcome is positive, the actions are ethical. In this case, the nurse could argue that telling Joseph the truth about his illness was wrong because it would have negative consequences. For example, the family and physician would be upset with the nurse for going against their wishes. The bad news would likely upset Joseph and have a negative effect on his mental health, and finding out that his doctor and family had been hiding the truth from him could cause tensions on their relationships due to lack of trust. However, the nurse could also use consequentialism to argue that telling Joseph about his condition is indeed the right thing to do. Telling him the truth would allow Joseph to plan for the future and make the most of the rest of his life by prioritizing the way he spends his time. For example, if he knew how unwell he was, he might be able to spend as much time with his loved ones as possible. Another theory is the ethics of care. According to the literature, there are 4 strategies of caring, these being caring about, taking care of, caregiving, and care receiving. along with the 4 elements of attentiveness, responsibility, competence, and responsiveness of the caregiver. This relates strongly to the nursing code of ethics because all nurses have the responsibility to care for their patients. Using these principles in Joseph's case will help the nurse to come to an ethical decision because at the end of the day, it is within Joseph's rights to be informed, and as his primary caregiver on this shift, it is the nurse's responsibility to do what they can to give him this. Issues arise when the nurse considers whether they will be able to implement all of these elements of care by telling Joseph about his diagnosis on this particular shift. There are usually only a few staff on overnight, and the nurses have a high patient ratio, meaning that the nurse may not have the time to adequately discuss the diagnosis with Joseph. Therefore, it might be more appropriate for the nurse to ensure that the bad news is given at a time when they can be fully attentive to Joseph. In addition to this, the nurse needs to consider their own competence. It is extremely important that the person giving the bad news has enough knowledge and information about the bad news in order to appropriately communicate this news, and answers for all the questions that Joseph might have. If the nurse does not have in-depth knowledge about the issue, it may cause misunderstandings and misinterpretation, and therefore could result in the deterioration of patient-healthcare provider relationship. One further theory the nurse should explore before making this decision in regards to Joseph is principalism. This theory considers 4 significant bioethic principles such as autonomy, non-maleficence, beneficence, and justice in order to influence ethical decision-making. Autonomy refers to a person's right to make their own decisions. In order for a solution to be ethically sound, Joseph needs to be able to have opinions, make decisions, and take action based on his own personal values and beliefs. Therefore, based on the principle of autonomy, it is necessary for the nurse to respect Joseph's wishes and tell him the truth about his diagnosis in order for him to be informed enough to make decisions about his care. A decision cannot be made based on one principle alone. The principle of non-maleficence refers to the idea that in order to be ethical, one must first cause no harm. Telling Joseph his diagnosis without a support person present may cause harm in regards to his mental health. Being told that he has a disease that cannot be cured is presumably devastating news, and literature suggests that having a support person there to comfort the patient and work through this emotional time is crucial to the patient's ability to cope with the bad news. The nurse needs to consider that it would be inappropriate to tell Joseph his condition when he doesn't have a support person, as this would likely have more of a negative impact on his mental health than giving him the bad news at another time. If the nurse chose to tell Joseph the diagnosis, it may also cause harm to him in regards to his relationships, impacting with his care and his home life. For example, he may lose trust in the healthcare team and with his family who kept such an important secret from him. Therefore, the principle of non-maleficence argues that the nurse should not tell Joseph about his diagnosis. The principle of beneficence requires one to take action based on maximizing possible benefits whilst minimizing possible harms. In this situation, the nurse needs to act in a way that is best for the patient from his view. Informing him of the diagnosis would be upholding the patient's rights and his wishes, and we would also be doing good for ourselves, as our nursing registration would not be jeopardized by breaching the patient's rights. The 4th principle to consider in ethical decision-making is justice. Formal justice refers to appropriate, equitable, and fair treatment with regards to what is owed to a person. There are 2 different types of justice, however in this case, retributive justice is the most relevant. This idea is that everyone should be treated equitably and fairly, and that equals should be treated equally and unequals unequally. Within the healthcare setting, this means that everyone should have equal access to health resources. Justice suggests that telling Joseph his diagnosis is fair in this instance, because it would allow him to learn which care and services he could access. When caring for patients, it is necessary to consider cultural safety and the need to ensure that all care given is considered culturally safe. De Souza explains cultural safety as an ethical framework by asking a number of questions to help us determine whether the outcome was culturally safe and ethical. For example, De Souza asks, what further information do I need to gain a better understanding of the situation? And Is it possible to develop a shared understanding of the problems and hear the perspective of all those involved? For this, the nurse should consider trying to find out why the physician and family decided to keep the diagnosis from Joseph. In some countries and cultures, doctors choose to give bad news to families, who then decide if and how to tell the patient. Therefore, if the patient was from one of these countries, it might be culturally appropriate to proceed in that manner. De Souza also asks, what is a choice that everyone can live with? If Joseph wants to be told his diagnosis, it is necessary to tell him. However, excluding his family from this decision and the communication of this diagnosis to Joseph may not be culturally safe. Many Maori people highly value their family and prefer to have their family involved in their care. Although the family should not have been told before Joseph, it is necessary to consult with them before going against their wishes. It might be beneficial for the nurse to explain to the family why Joseph may be told about his diagnosis. If they understand this, they may even be able to provide suggestions for the best way to break the news to Joseph. There are 5 main ethics of virtue that a nurse must consider in their practice that are applicable to this case. These are courage, sincerity, compassion, generosity, and faithfulness. In this situation, the nurse needs to have the courage to advocate Mr. Kingi's case to the nurse manager and consultant who is currently on shift to explain the situation and come to a moral and ethical decision. The nurse needs to be sincere and compassionate in their conversations and care of Joseph, and reassure him that they will make sure he is informed and receives the answers that he needs. The nurse can utilize the virtue of faithfulness by following up with staff and the patient to make sure that the issue has been resolved. The Health and Disability Commissioners Code of Health and Disability Service Consumers' Rights Regulation 1996 holds the rights of patients which need to be upheld within the healthcare sector. We have previously discussed these rights and how they are being breached in Joseph's situation. Patients must be able to make their own health decisions and choices in regards to what they want for themselves. This always outweighs the decisions of the medical team and family members and caregivers. It is clear that Joseph values being given the truth, which conflicts with his family values of preventing him from distress. This is why, as nurses, we need to be careful that our personal values do not influence our professional decisions. So from this perspective, Joseph needs to be told about his diagnosis as his values are the most important. There is clearly an ethical dilemma in this scenario, because there are many courses of action that could be taken, as there is no clear right or wrong answer. There are conflicts of interest within this scenario, which means that whatever action is taken, at least one party will not be happy with it. The Nursing Council of New Zealand Code of Conduct has 8 principles for which New Zealand nurses must follow, as without the public's trust and confidence in the nursing profession, nurses cannot fulfill their role effectively. The healthcare team from the previous shift have broken all 8 of the Code of Conduct principles in some way in this case, by knowingly excluding Joseph from knowledge of his own health. The healthcare team have not respected his dignity and individuality, nor have they respected his cultural needs or worked with him in partnership throughout his process. They will have lost his trust by the time he finally becomes informed, as he already knows that they are not informing him of something which is making him extremely anxious. The team have not respected health consumers' privacy and confidentiality, as they have already informed his family without his consent, when he may have chosen not to tell them at all or inform them at his own decision. They have not worked respectfully with their colleagues either, as the nurse coming onto shift is confused and doesn't understand why they have not informed Joseph. As the nurse coming onto shift, it is our responsibility to talk to the consultant to ask why he has kept this information from Joseph and not treated him within his rights, and to remind them of their ethicalities and what they should be doing next. If the consultant maintains their choice not to tell Joseph about his condition, the nurse could approach their nursing manager, the ethics committee, and consultants within the hospital. They could then discuss the dilemma and offer teaching to both the nurse and consultant on their ethical obligations. The nurse could also research the literature surrounding these ethics and use this to explain to the consultant, nurse manager, or board why they believe that this is an ethical dilemma. Hopefully, this could allow Joseph's consultant to understand the bigger ethical picture and take appropriate action to inform Joseph of his diagnosis. The nurse facing this decision has many options. Firstly, they could stick to the doctor and family's wishes and withhold the diagnosis from Joseph, allowing them to tell him when they are ready. This would keep the family happy. However, it would not ease the distress and annoyance that Joseph is currently facing, and would also breach Joseph's right as a health service user and would not help to resolve the fact that his privacy has been breached. Doing nothing would also put the nurse's career in jeopardy, as it is illegal for the nurse to unethically deny the patient's rights by actively keeping his diagnosis from him. Secondly, the nurse could tell the patient's diagnosis. This would be ethical from a truth-telling perspective and allow the nurse to immediately uphold the patient's rights as previously discussed. This would have some negative consequences related to coming between Joseph and his family. It may impact negatively on Joseph's mental health because he doesn't have anybody there to support him as he is receiving this news, as it is a night shift and his family may not be available. Additionally, the nurse may not have enough time to give Joseph all the information and support he would need following the bad news, as there is less staff on at night. The nurse may not also have enough knowledge to fully explain it to Joseph, potentially causing confusion and further distress. The third option is that the nurse could ensure that the patient is told of his diagnosis, but not do it herself. The nurse could hopefully settle Joseph for the night by reassuring him that they will make sure he receives answers soon, and allow the nurse time to consult with the physician and the family to gain a better understanding of the issue and explain why Joseph needs to be told. In this situation, the nurse would be advocating for the patient's rights, while hopefully coming to an agreement with the physician and family to ultimately respect their wishes. This could potentially allow for the physician and family to explain to Joseph why they neglected to tell him, and hopefully limit any damage to those relationships. Our chosen plan of action is as follows. It would be inappropriate for the nurse to give Joseph the bad news during this shift, as he does not have a support person present, and the nurse is unlikely to have the time or capability to be able to provide enough information or support for Joseph due to the nature of the night shift. Therefore, the nurse needs to ensure that Joseph is settled for the night and reassure Joseph that although the nurse is unable to give him any answers right now, they will ensure that he receives answers as soon as possible. The nurse should approach the consultant and family to ask the reasons for their actions and discuss which needs to happen next and how. As a nurse, it is important to advocate for patients' rights. Joseph has a right to know what his diagnosis is, and ideally, this diagnosis will come from the physician, while Joseph has loved ones around to support him. This is because the physician has the most knowledge about the diagnosis, and in this instance, it would be important for the nurse to ensure that the physician provides Joseph an explanation as to why he chose to breach his patient's rights and privacy. If the nurse is unable to change the physician's mind, and they decide to continue to withhold the diagnosis from Joseph, the nurse should consider the next best option. The nurse should talk to their manager, and perhaps the ethics committee, to determine the best course of action. In the morning, they should hand over to the morning shift nurse, as well as their nursing manager, as to what has happened and why the diagnosis needs to be given promptly. Following this, the nurse should follow up to ensure that action has been taken and that the patient's rights are upheld. Ideally, in this situation, the nurse will play the role of the advocate for the patient. The nurse's role is to communicate with Joseph, the healthcare team, and Joseph's family to ensure the patient's rights and values are upheld. The nurse should ensure that the healthcare team inform the patient of his condition in an appropriate manner, where he has the opportunity to ask questions and gain all of the information he needs regarding his condition, and also has the option to have a loved one with him for support while he is receiving the bad news. Ideally, the nurse, especially the night nurse, would not give the diagnosis, as they may have many other patients who require their care and may not have an extensive enough knowledge of Joseph's condition to answer both his and his support person's questions. However, if the nurse finds on her next shift that the diagnosis has still not been given and without real reason, they may need to give the diagnosis themselves. Based on the ethical processes we have just discussed, Joseph needs to be informed of his condition by his consultant in an appropriate and timely manner that upholds his rights and autonomy, as well as respecting him as a patient and a person. The nurse would see that this happens efficiently, and Joseph receives the care that he deserves and is entitled to, along with insurance that his family is notified and, if Joseph wishes, included in the following steps of his treatment. In this case, there may need to be interventions by the hospital management to re-educate their staff on how to approach ethical decisions and the morality behind informing of diagnoses. Education on when, how, and what is the appropriate time and situation, and who is required to inform patients is important, along with family management and security of patient privacy. The clinical team on the ward should all be on the same page in regards to this, so that ethical dilemmas such as this case do not occur again.